Okay, so for this video, we're going to be looking at how to gently mobilize the wrist and elbow. So if you're having issues with carpal tunnel or just arthritis or pain of sorts or just being locked up, want to work on that. So I'm going to do this over the table. You can use a countertop. Just make sure that you are supported. You might be able to do this sitting if it's low enough, but I'm going to do it standing so I can be over my hand. I'm not going to put a lot of weight here, okay? So you can if it's not painful or you don't have any other issues that would be where you shouldn't load that so much. But I'm going to just keep my weight more in my hips and my trunk here so that I can have full control here. So I don't want to overload pressing, especially if it's painful or if you have like rheumatoid arthritis or things like that where you don't want to put a lot of overload into the joint itself. So I'm going to take my other hand here and use the web space here, my thumb and forefinger. I can go here. If you can't reach through there, or you have a reason why you can't do that, you're gonna maybe just take the heel of your hand on the side towards the thumb here and just gently push. So I don't wanna, again, push too hard from this side either, especially if you have issues on this side. So I'm going to use my body and maybe kind of anchor with this hand and anchor that hand down. And as I do that, I'm gonna try to maybe pull my weight away to distract it and then come up and over like this. So I'm anchoring my hand down with my other hand on top, pulling it out, keep that tension. So I'm on the same side leg as I am the hand here, stretching out and opening like that to stretch in here and then to open the joint so it's not pinching, and it allows me to gain that wrist extension. And that wrist extension is very important. Anything we do with our thumb, usually we need more wrist extension. Flexion is a little awkward to work the thumb like this, so usually better here for opening doors or jars or anything. Okay. Speaking of opening jars, you can look at like the forearm here, but maybe first I'll do the wrist flexors real quick. So that one too, like that's going into extension, right? But if I'm going into flexion, and again, if I'm getting pinching here, I'll be very mindful of that. So I may have to turn my hand like this. And now I'm going to pull that way and open up that way. So if I'm tight in my extensors, this might be a good way to do that one. Okay, I might be able to bias it back or forward if I need more radial and ulnar deviation. But we'll start with nice and easy and simple with the getting extension, gaining flexion. Okay, and then the opening the jar is like twisting at the forearm, which was really like between the elbow and the wrist here, the radius turning on the ulna. And so if that's kind of tight and stiff, I might need to, kind of stretch and open here. So going to extension. Right, with extension of the elbow, that I'm going to do my supination, that's called, like I'm holding a bowl of soup here, palm up, okay? Pronation is the other way. Usually pronation is less limited, but I could kind of do the same thing here. Kind of moving and then kind of pulling that down kind of through the skin. Not too aggressively, just nice and easy here. And if I want to do it more in a bent elbow position, I can get lower or do it in seated perhaps. But I'm just trying to stretch that out a little bit there. Pull through my body, lift, and then stretch it out. There, and then there. Just nice and easy and gentle stretching. The elbow is usually a pretty stable joint, so you don't have to worry about pulling. Just maybe more about your other hand if you're dealing with that. So that's kind of how we can kind of work through some of those motions. Perhaps again, like if I go sideways, I can just be very mindful of your thumb here. You don't want to pull on your thumb. You want to get closer to the wrist here. Maybe kind of something like that. That way. The thumb down one's a little tricky, but I might be able to do it a little bit. Kind of move forward here with my palm flat for that one. So those are just another couple of things you can kind of work on with all those movements. That should pretty well cover it. Extension, I guess we didn't get that one. Extension here. Don't want to force that one either. So as I'm extending, maybe stretching through here, but I'm going to pull. Maybe just a straight pull, actually.
Nope, we're not gonna do the knee again.
So if I'm pulling up there, but I'm eventually gonna stretch down. The biceps could be tight here. I'll open that up. That can help there.